October is Breast Cancer Awareness Month, and my guest this morning here on Jersey Magazine is the regional manager for ImageCare Radiology. Katy Lynch, good morning and welcome.
Good morning. Thank you.
I wanted to talk to you about the impact of the diagnosis of breast cancer. What goes through a woman's mind when she hears that?
Yeah. I don't think there's one clear answer for that. We deal with a lot of patients within our facilities that go through this on a daily basis. And I think for a woman, it's such a personal thing to be told that everybody handles it very differently. Just the ones that I've been with personally, I can tell you so much goes through what they're experiencing. Their family members, it depends on the age that they've been diagnosed. If they're on the younger stage, obviously it's a very different feeling versus when a woman is older. But family is huge, right? So for a woman, it's whether they have children or they have special partners in their life that this is going to affect. A lot of it too is how they can afford it. How are they going to afford treatments? If they're working full time, how are they going to manage all of this? The trickle down effect is huge. It's so paramount. So there's so much involved with, and I do think I could probably say for every woman across the board, it's devastating, right? It's just that fear factor, that unknown factor of, am I going to survive this? What am I going to do now? So I think that's the biggest response is just, it's a devastating thing to hear, that type of news to hear.
My mom went through that some years ago, and while she did survive it, the initial diagnosis, when you hear that, is because you don't hear anything else after that for a while. All you hear is you have cancer, your mind races, it's off to the races, and you're not hearing anything else the doctor says.
Yes.
So there's always that period of whoa, and then you kind of adjust and get to whatever you want to call that new normal, I guess.
Absolutely. The new normal. It's perfectly said that way.
How do you think it affects mental health?
Oh, I think it plays a huge role on it for sure, because you're dealing with so much anxiety, right? And then if you couple that with someone who might have already some anxiety issues or mental health issues, you put that type of stress, that fear on top of that, 100% it's going to affect the mental health of that patient. And it all depends on their support system too. That's a huge factor for a lot of women who are diagnosed with this, is what type of support system do they have? If they have to go to chemo and their response to the chemo is, not good as far as how they're feeling afterwards. So they have someone to drive them home. How do they get that support system? So there's so many different things that go into play with that for sure.
We mentioned at the beginning that you are the regional manager for ImageCare Radiology. What brought you in your journey to them, Katy?
So I started here at ImageCare when we were probably about 10 years ago. I am a born mammotech. That's what I do by trade. I came on board when we just started mammo. We had no patients, and then we developed this amazing program with ImageCare, and I kind of just continued to work my way through that from lead technologist to director. Now, of course, we have 16 mammography sites and breast centers. And I will tell you, since day one, the most rewarding part of the job was dealing every day with the patients. I don't get to do that as much, but I miss it very much because we meet so many women all day long with what we do, right? Everybody's story is so unique. There's not one story that is the same. And I think for all the mammotechs and all the imaging breast technologists that work with these patients and are helping them with getting their imaging, getting their mammograms, their MRIs, their ultrasounds, we value so much with knowing what services we have to provide for all of these patients. So that to me is still something that I will keep forever as I grow through this journey of what I do.
What do you think it is that makes ImageCare Radiology and Pink Breast Center different?
So ImageCare, Pink Breast Centers. Well, one of the things that I can tell you right now that makes us different is beyond the staff and the amazing staff that we have is also the technology. We have the best technology. We work with cutting edge technology. We work with everything that we do as far as mammography is concerned. It's all 3D, along with we utilize what we call artificial intelligence, which everybody, right? That's the big hub these days. But the artificial intelligence is such a huge benefit that we are able to provide for our patients, because it's helping those doctors while they're reading their mammograms. It's helping those doctors to see those very early stages of breast cancer, which is exactly what we want to do for all of our patients. We want to be able to find it at its earliest stage. The earliest stage, it means it's very treatable. That's the whole thing, right? And we provide a lot of these services, the 3D and the artificial intelligence, all of that we provide at no extra fee to our patients. So whatever they're receiving, whatever is done through their insurance, that's what we accept. We don't put any additional burden on the patient for any of those extra services. So it's something that we're really proud that we're able to offer.
I'm glad you brought up artificial intelligence and you talked about it being a big buzzword now. And in some industries, it's like, whoa, we got to
Yep.
hold back on this. We think of out in Hollywood where television and movies are made, they're using so much artificial intelligence instead of real sets to work on. Voices are being duplicated, if you will, all kinds of things like that. So there's
Yep.
this, wait, we got to hold back on this. Yet with you, I think artificial intelligence, the help in the screening process, you cannot understate that.
100%. So it's kind of bad because it gets a bad vibe out there, right? But for what we do and the technology that it provides, it's a massive advantage to the patients, massive. So for us, we are very welcoming to it, and the benefits and the early diagnosis have been just phenomenal for so many of our patients. So yeah, so for us, no bad buzzwords for artificial intelligence at all. We're grateful to have it.
And if I'm not mistaken, you're actually the first with, or among the first at least, with FDA approval to use AI in this.
Yes, you are correct. Yes. So we're very proud to offer it.
Where are your centers located? I know you have, I think, 16 of them.
Yep. So we are just opening a new center starting next week in Randolph, New Jersey. We have sites in Vernon, New Jersey, Newton, New Jersey, Sparta, Hackettstown, Denville, Morristown, Milburn, West Orange, Wayne, Fairlawn, Middletown, Woodbridge, East Brunswick is going to be another one we are going to be opening very soon. We also have our big pink breast centers, which are Flemington and Patterson. And then we also have a location in Annandale, which is Hunterdon County.
So it's kind of like the old radio cliche. If you're within the sound of our voice, you're near one of the centers, right?
Exactly. And one of the big things I just kind of want to put out there right now, which I'm wearing the t-shirt, this is our own little hashtag where it says everything else can wait. So that's the biggest thing that we like to tell all of our patients. I know personally myself, right? We get so caught up in our families, our kids, our work, everything else, taking care of other of people in our family that need to be taken care of. Women have a tendency to always put everything else in front of them, right? Instead of themselves. So this hashtag is basically just saying exactly that. Everything else can wait. We take the 1 hour out of your day to schedule that mammogram, come in, get your mammogram, get your ultrasound. It is worth it. Just everything else can wait at that point, right? So just come in and get that screening mammogram. That's something that we really want to push to all throughout breast cancer awareness, and of course throughout the whole year.
Katy, for listeners who want to learn more about Image Care Centers, where can they go?
Yep. So we have a website, which is pinkbreastcenters.com. If they go on that, they'll be able to look at all our locations, and they'll be able to read a lot of great information about all the services that we provide. And we also have some articles on there if they want to get some more info about the mammo units itself, the breast ultrasounds, the breast MRIs, all of that, and all the other wonderful services that we offer. But it's pinkbreastcenters.com.
Katy Lynch, Regional Manager for ImageCare Radiology. I'm so glad you were able to join us this morning here on Jersey Magazine. Thank you so much for your time.
Thank you so much for having me. It was great talking with you.